Back now on Triad Today, and we have a special guest who was with us one time before, and we asked him back, and believe it or not, he came. Next to me is our good friend, Dr. Michael Merz. He's a physician with Northern Family Medicine in Mount Airy, part of the Northern Regional Hospital family, and we welcome you back.
Thanks for having me again.
By way of Ohio and Massachusetts, and well-traveled, and we're just glad you're in this area now. And you're like a medical person. You look after the athletes at one of the high schools in Surrey. What is that?
Yeah, so I'm actually the team doctor for North Surrey High School right now, taking care of the athletes, seeing them in clinic as they need to, and seeing them at the school sometimes.
Yeah, I think that's great. And that sort of brings us to the general topic that I want to talk about, because it seems like year long now there's something going on. I mean, people, they're either playing football or practicing football or playing baseball. They're into something. So let's talk about exercise for a minute. How often should a normal person exercise?
Mm-hmm. So the CDC, the Center for Disease Control, recommends 150 minutes of moderate intensity exercise. So that's 2.5 hours per week of moderate intensity exercise.
Now, what would you refer to as cardiovascular exercise? Because I saw that in an email that you sent me. I wanted to know.
Yeah, so cardiovascular exercise is anything that gets the heart rate up. And so it can be as simple as a brisk walk with a dog or a friend. It can be jumping jacks, squats, anything that gets your heart rate going and start to break a sweat there.
All right, so if I do just general walking, maybe I don't break a sweat. So how often each week should I try to break a sweat?
Yeah, so again, the 150 minutes or 2.5 hours is the main goal. I tell people one simple kind of way to think about that is about a half an hour, 5 days per week. And so trying to do every other day, maybe a few days in a row sometimes.
Now, if somebody's starting back, hasn't exercised in a while, there was this old phrase I used to hear, ask your doctor first. Is that still a good idea?
I think it's a good idea if you haven't exercised in a while. The reason we say that is we want to make sure that people's heart is healthy enough to withstand that moderate intensity exercise. And so things like having a blood pressure checkup, letting your doctor talk to you about heart-specific symptoms is probably a good idea if you haven't gone exercising in years.
Now, hand in hand with that, I know you're a big proponent of folks eating healthy. What do you say about eating a nutritious diet? What advice?
I think it's always important to think about your diet. And one way to make it more nutritious is just be really aware of what you're eating. And so I tell all my patients it's really important to read nutrition labels. And sometimes they're not the easiest to understand. And that's one thing you specifically can talk to your doctor about is what does all this mean and how will it affect my health?
Yeah, Doc, you know, it seems like there's a million weight loss centers out there, a million different pills you can take and all these things online. So isn't it more important to just sit down with your physician and sort of figure out what's best for you? I mean, what kind of advice do you give on that?
Absolutely. I think individualized dietary health is really important. And that's why it's important to have a good relationship with your primary care doctor so that they know all of your coexisting or pre-existing medical conditions. They can really tailor a dietary plan to you and treating those kind of conditions.
You know, when you were here sometime before, we asked about what, led you to a career in healthcare, and you talked about your mom having been a nurse. Let me ask you sort of a similar question, and that is, what's gratifying to you about the career that you've chosen? Here you are in your own practice, and you're seeing adults. You're also working with kids in sports. What's gratifying?
I think it's really, really gratifying to see kind of the advice you give or the medicines you use make a positive impact on someone's life. And, I see 20 or so patients a day, maybe some more sometimes, and it's thinking about the impact that you can make just by having a good discussion about a diet or an exercise plan. Really, it's invaluable. It means so much to me.
Doc, I appreciate what you're doing, and I want to make sure, in case people want to reach you or make an appointment, you can call Northern Family Medicine at 786-4133. That's 786-4133 in Mount Airy. And also, please visit the general website for Northern Regional Hospital. That's choosenorthern.org, choosenorthern.org. Dr. Michael Merz, thanks for doing that.
Thank you. Thanks for having me.
All right. We'll be right back.